Greetings, boys, girls, and gender rebels. I'm Penny Underbust, and today I'm going to share with you all the story of Penny's first boob job. As you can see, I'm filming from bed in an attempt to put myself in a more relaxed atmosphere so that I will be more comfortable sharing such a personal story. Okay, so the first thing that I did before anything else was find the right surgeon. A lot goes into picking the right surgeon for cosmetic surgery. But for me, the most important thing was finding someone who specialized in very large natural breasts and also in large implants. Because most breast augmentations are done to women who have, to people who have not that much breast tissue, it is actually a specialist thing to be doing it to someone who does have a lot of breast tissue. And then on top of that, I couldn't just go with a normal sized implant, because when you start with so much, putting something that small into it makes it get lost very easily. So I had to find a specialist in those two areas. And then once I'd found a couple of those, I compared, first and foremost, obviously, quality of results, and then things like bedside manner and location and price and stuff like that. But that stuff does come long after quality of result, obviously. Anyway, the surgeon that I ended up going with was located in Florida, in the USA. And unfortunately, I can't tell you the name of the surgeon because this story is pretty negative. And surgeons are super litigious, and I don't want to get sued for having a negative experience, so I'm not going to tell you who they are, and I'm sorry about that. Okay, so the day of my first appointment arrived, and this was basically just my initial check-in, where the surgeon shows me different sized implants and the things that you see in movies when they draw on people with the Sharpie. That's basically what that appointment was. And it was a really positive experience. The surgeon was super lovely and really genuine, and he answered all of my questions, and he answered questions that I didn't ask, which is a really good sign. And it was a really good experience. But then the day of the actual surgery arrived, and firstly, he doesn't have his own private surgical suites. He uses a hospital. And that's bad for a bunch of reasons. Probably the most obvious reason is that when you work in a hospital, it puts your patient in a kind of negative headspace. Like when you're dealing with the hectic environment of a hospital and you've got sick people everywhere and people who are dealing with extreme grief, and when you're going for a cosmetic surgery, that's not the environment that you want to be in. But on top of that, the real bad reason for me was that he didn't have his own hand-picked staff. He's using the staff that the hospital has. So I show up at the front desk and I'm like, hi, and I'm getting my little wristband thingy that says, Penny in this hospital is allowed to be. Anyway, so I go up to the counter and the lady's like, hi, so I guess you're here to get a breast reduction then? And I'm like, no, I'm here for a breast augmentation. And she just freaked out. She was so negative about it. She started first of all, she just looked at me really judgmentally, and then she was like, why would you do something like that? And I'm like, I like really large boobs. And she's like, you already have really large boobs. You're spending so much money on something that you don't even need. Why would you do this? And it's first of all, nobody needs to get a breast augmentation. It's not necessary for anybody. It's always something that is up to the individual person to decide if they want or not. Has nothing to do with need. But the fact that she was like, you don't even need it. You're being crazy for doing this. How can you say that to someone who's about to undergo surgery? She knows I've paid and that I'm about to go under the knife. And instead of just shutting up, she opened her mouth about it and put me in this kind of defensive, negative headspace. But anyway, that was short enough. I got my wristband and then I went back to my little waiting room thingy and they put me on a gurney. Is gurney the right word? I feel like gurney, like I associate gurneys with cadavers, but that's probably just like me being incorrect with terminology. You know, like the bed with wheels. the hospital bed thing. They wheel you around on. Anyway, so I was sitting on that. And I was with my husband and we were just chatting about how exciting and cool it was that I was getting to do this thing that I'd been wanting to do for like years, like at least 15 years at this point. And then the anesthetist and her, what's the word I'm looking for here? Her sidekick. Penny, there's a direct right word for this that you were just missing because you're silly. The anesthetist and her assistant come in and they're, you know, chatting away as you do. They're doing the whole friendly bedside manner hospital staff thing. And they're like, oh, so you're here to get a breast reduction, right? And I'm like, no, I'm getting a breast augmentation. And they just both go completely silent and like stop talking to me. And they start kind of whispering to each other and looking sidelong at each other and looking over at me. And it's like they weren't as upfront rude as the front desk staff, but it's like they'd been super friendly and like, hey, where are y'all from? And like, oh, you're Australian? Welcome to America and stuff, like moments before. And then all of a sudden it was like I'd told them I was going to go out and murder a bunch of babies or something. And so my husband and I just sat there in that awkward silence. And then the anaesthetist notices this keloidal scar that I have on my shoulder. And I don't know if you can see it because I have really bad acne at the moment. But, you know, it's a scar that stands out. Like, it's a big red lump on my back. She notices it and she looks down her nose at me and she says, you know you're going to be covered in thick, ropey scars? And she used the word ropey, like that word. She's like, your boobs are going to be covered in thick, ropey scars. And I was like, well, what do you mean? She's like, that's a keloid on your shoulder, isn't it? And I'm like, yeah. And she's like, that means that all of your scars are going to be keloidal. And if I'd thought about it for like 10 seconds, I would have realized she was wrong because I have plenty of scars on my body that aren't keloidal. But just this, I was already in such a nervous headspace. Like I was about to go under the knife for the very first time in my life. Like I've never had any surgery at all up until this point. And so it's like there was that nervousness and the lady at the front desk and their sudden like baby murder hatred and just her suddenly just this incredible like you're going to be horribly disfigured face. Like I just started crying. Now I'm a person who cries very easily, but I'm always like I cry sort of as a natural reaction to a situation and I have no control over my eyes leaking fluid, but I'm normally incredibly level-headed. Like, even though I'll be sobbing, like, my brain has no problems still deciphering a situation and being very rational and level-headed, but something about this situation just totally broke me down. Like, I started freaking out. Like, I'd been totally comfortable with this whole thing for so long before. Like, we'd been planning this for months. We flew all the way to Florida from freaking Okinawa and we'd paid a fortune for this surgery, and at no point had I been concerned or worried or even slightly anxious about it. And now all of these women are just being really horrible to me. And then when she told me I was disfiguring myself, I just melted down. And of course, my husband was still with me at this point, so you know, he wraps his arms around my shoulders and he's like, Penny, we can just leave. Like, we don't need to, like, we can just go. We can go right now and it doesn't matter. Don't worry about the money. Who gives a crap? like, just screw it, let's go, if you're freaking out like this. And you know, I really didn't want to leave. It's something I've been looking forward to for many, many years. Fortunately at that point, well, fortunately and unfortunately, the surgeon comes in and he sees me crying and freaking out, and he's like, whoa, what's wrong? And I basically told him what the anesthetist had told me. He just looks at me and he says, Penny, that's not going to happen. Like, you're not going to get scars. This little mark on your arm, that's because you were a kid and you didn't take care of it properly, and like you didn't do the right things. And like, I'm a professional board certified surgeon who deals with incisions and sutures constantly. I don't leave scars. Like, it's not something that happens. It's not possible. And he was just so over reassuring about it. Like, he basically told me that it was physically impossible for him to leave a scar. And logically, I know that that's bollocks. Like, I know that you get scars sometimes when you have surgery. And not just that, but my surgery specifically was a donut masopexy, which involves fully removing the nipple. And my areola color is the exact same color as the rest of my skin. So most people would normally hide that pigment change in like the brownness of the nipple or the dark pink or whatever. But because it's the exact same color, like, I'd always assumed that I was going to have some scarring. Like, I went into it with the knowledge that I was going to come out with a scar. But he like way over reassured me, and he just told me it's physically impossible. Like, he couldn't, like, it's never happened to him, and don't be silly. So, you know, I went through with it, and I don't regret that decision for even a second. Like, I want to make it abundantly clear that there is no regrets for having gotten my surgery. He did a great job placing the implants, and his, like, I had, like, no healing time for this surgery. I followed all of his instructions to the T, and I was completely off pain meds after, like, 4 days. And that's a huge deal after a breast augmentation. Admittedly, I can take a lot of pain. Like, admittedly, I am pretty hardcore when it comes to that sort of stuff. But it was like 4 days and I was completely off them. I flew back to Okinawa like 3 days after my surgery. And, sure enough, 3 months after my surgery, I noticed that my incision side is kind of standing out a bit. It's not totally flat with my body, and it seems kind of like a dark red color. So I take some photos and I send them into my surgeon, and I'm like, hey, it looks like I'm getting some scarring. Is this a complication? Like, have I done something wrong? Is there something I should have been doing that I didn't know I should be doing? Like, you know, I'd done all of the things that all of his aftercare documents had told me to do, but maybe I missed out on something that he would have assumed is super obvious or something like that. I was basically just trying to check, like, what happened? Like, why do I have scars after you told me there's no possible chance? And his email response was so negative. Like, he responded telling me I was insane for having such ridiculous expectations, and he threatened to show me photographs of what an actual complication looks like and how I needed to just sit down and calm myself because I was a hysterical woman for even considering that this was a problem. And like, he just lost his crap at me. And a big part of me just desperately hopes that he was in a terrible mood and that something really bad had happened that morning or something to make him respond to a patient like this. Like, I desperately hope he does not talk to anyone who comes at him with complications like that. The actual end result was that I was incredibly pleased with my surgery. Scars don't bother me. This keloid on my shoulder, I don't give a crap about it. Like, I went into this surgery in the first place assuming that I would come out with some marks. Like, marks don't bother me. Like, I'm excited about having really large boobs. I don't really care if there's signs that I got them done surgically. Like, it's the fact that he so oversold himself. Like, and then he responded so negatively afterwards. It was just so unprofessional to me. It felt like a 14-year-old responding to something, and it's like, when it is your job to take care of patients, and bedside manner is such an important part of being a cosmetic surgeon, like, this is an elective surgery. Like, people can just go to someone else if they're negative, but it just, like, I did not go back to him for my second surgery, in spite of the fact that he did do a pretty good job of placing my implants and everything, and the scarring was somewhat minimal, like, whew, hugely negative, simply because of the fact that he didn't handpick his staff, he didn't warn people that he was doing a specialty surgery, and then he responded like a crybaby over things. So yeah, I guess that's my whole story. That's my story of my first augmentation. This video has probably been hella long because I haven't really had much, like, there's not much I can edit out, and I feel like I've been talking forever. Blah, 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 ever to the point where I'm stuttering my words. But yeah. If you've enjoyed this video and if you want more personal stories, please hit the thumbs up button or leave a comment down in the comments section. From the bottom of my little black heart, thank you for watching. Goodbye! I don't know if laying in bed helped any. My biggest problem with videos is that I get all anxious and nervous about saying something wrong and then making people think I'm a terrible person. I'm not a terrible person, am I?